In a moment, we're going to introduce the candidates who are here on stage, but I wanted to start by thanking our sponsors, particularly the presenting sponsors, Children's Hospital Colorado, Citywide Banks, and Denver Springs. Will you thank our presenting sponsors? And our leadership sponsors today are Health One, Pfizer, and Centennial Peaks. So thank you to our leadership sponsors as well. All of the sponsors for today's event have been listed on the screens behind me, and I just want to say thank you all for making this event possible. A special thanks to the staff and the volunteers who planned this. If you are part of the staff of Mental Health Colorado, the Board of Directors, the Board of Advisors, the future board, or the volunteers, will you please stand so we can acknowledge your contributions to this event as well? And to the folks who prepared and served our food today, and to the folks at the Police Protective Association Event Center, thank you for your service as well. So over the last several weeks, we've received dozens of questions. We've tried to distill them into those that you'll hear today. I just want to thank everybody who took the time to pose a question to the candidates and to show us how much you care about this issue. You also showed us in the questions you posed how much work we have to do to make Colorado a national leader in the prevention of mental health and substance use disorders, which is the goal of our organization and in some ways the goal of today's forum. I will tell you, as a spoiler alert, we're not there yet. Colorado is not yet the leader in this field. We can get from here to there, and we hope to learn today from the candidates how we do that. But as we sit today, more than 1 million Coloradans experience a mental health or substance use disorder. Only half of them are getting the treatment they need. And I know for many of us, including my family and so many folks I've met, this issue is literally a matter of life and death. So we have a lot of work to do, and I hope that the pace of our work matches the urgency of this mission. I know it is a cause that matters as well to today's moderator, so it is a great pleasure to introduce her now. Denver 7's Teresa Marchetta anchors the 4 p.m. show called The Now. She is, as you may know, an award-winning journalist. Westward and 5280 magazine have named her Best Anchor. She even won the Emmy twice for Best News Anchor. But she is most proud of her 3 amazing children. And although it doesn't say it here, I assume their names are Emmy, Tony, and Oscar. Is that right? So please welcome the star of our stage and screen, Teresa Marchetta, today's moderator.
No, they are Stella, Mia, and Liza, Andrew.
I was close.
Yeah, you were close. Just off by a little. Thank you so much, Andrew. Welcome to the state of mental health, and thank you all so much for being here this afternoon. And I want to say just a quick personal note that I think it's important to point out that Mental Health Colorado has really kept the issue of mental health at the forefront since its inception. I think at the top of the agenda, socially and politically, probably more so than any group in recent memory, any nonprofit in recent memory has. And so as a journalist who covers these stories on your behalf and tries to hold the powerful accountable on your behalf when it comes to mental health challenges that we face, I am proud to be a part of this today and thankful to Mental Health Colorado for providing this forum for these candidates. It's an important thing we're talking about. We also, of course, want to thank all the candidates for governor for being here with us today and taking time out of their busy schedules to be here. I'm going to introduce each one of them, and then after the introductions, we'll go ahead and start with the questions that you're all here today to hear about. So we're going to go from left to right. We want to begin with real estate broker Republican Stephen Barluck. Thank you for being here. We are going to next go to Larimer County Commissioner Republican Lou Gator. Thank you for being here. Next, former state senator, Democrat Mike Johnston. Former mayor of Parker and businessman, Republican Greg Lopez. Lieutenant Governor, Democrat Donna Lynn. Entrepreneur and former state lawmaker, Republican Victor Mitchell. Next. And businessman, Republican Doug Robinson. Tech entrepreneur, Democrat Eric Underwood. Now we want to give you a few apologies. Carrie Kennedy, the former state treasurer and Democrat, was going to be here with us today. She has the flu, so we thank her for not sharing that with us. But we do have a representative here as well from her campaign today. We also want to extend apologies on behalf of Congressman Jared Polis, but we are happy that the congressman stayed in D.C. and he is doing his job. Big budget vote, and he got stuck there. We also invited Walker Stapleton to be a part of our conversation today, and he declined to do so. And I think it's also important that we say that our state attorney general is here, Cynthia Kaufman. Thank you for she was probably got stuck in the line outside. A lot of you here, so thank you all for being here, and thank you so much. So again, this is very important today. We've got a lot to get to, and because we do, we're going to limit the answers to 1 minute. So this is a pretty easy format to follow. So 1 minute answers, and think sound bites, right? This should be pretty easy. Derek is our friend. Derek is right in front here. And so at the 1 minute mark, or when you're getting close to that 1 minute mark, right around 50 seconds, Derek has volunteered. Okay, he's gonna wave the Colorado flag for us. We thought that was appropriate. And so he'll wave that flag. When you see him wave the flag, you know you've got 10 seconds to wrap up your comments. He will politely wave it again if you hit that minute mark. And if you go much past a minute, you get to see the mom and me come out. So Derek, thank you for volunteering to do that for us. We appreciate it. And so he's front and center so everybody can see him. I've instructed him to wave passionately as well, so you won't miss it. Our first question is going to come from Sasha Miller. I've been talking with Sasha. She's spending her first day of spring break with us today. She is from Erie. She is also with the Colorado Youth Advisory Council. Sasha.
Hi, everyone. My name is Sasha Miller, and I'd like to ask all the candidates what personal and/or professional experiences do you have which inform your views and opinions around mental health care, and how do you believe those experiences might influence your actions as governor of Colorado?
So it's a nice general question to start with, right? Sasha, thank you so much. For this first question only, we're going to deviate just a bit here because Policy Director for Kerry Kennedy, Will Toastburn, has come on her behalf. So we're going to allow him to answer this on her behalf, and then we are also going to ask the Policy Director for Congressman Polis, that's Shad Marib, who is here also, and we're going to allow each of them an opportunity to answer for this question only. So Will, we'll go ahead and start with you.
Hi, everyone. Thanks, Teresa. Thanks, Sasha. As you said, I'm Will, Kerry's Policy Director, and I am quite nervous. But mental health is an issue really near and dear to Kerry's heart. Her mom is a social worker, and she grew up with a number of foster care siblings, so she saw in her home the importance of mental health care to allowing people to build and live stable and successful lives. Early in her career, Kerry helped to expand the Nurse-Family Partnership, which provides mental health screenings and treatment for mothers and young infants. And that informs her first value when it comes to mental health, which is prevention. She is setting a bold goal to ensure that every school in the state has a counselor that is able to provide preventative mental health services to students. She also, as CFO and Deputy Mayor of Denver, created the Housing to Health Initiative, which provided housing first, supportive housing with wraparound mental health services for homeless folks in Denver. That informs her view of comprehensive and integrated care that allows people to get the care that they need, both mental health and social determinant care, to be able to improve and live successful lives. Thank you very much.
Well, thank you. Thank you so much, Will. All right. Coming up. All right, Shad, are you okay to hold this? Yeah. Okay, and he is speaking on behalf of Congressman Jared Polis.
Hello, hello. Everybody, my name is Shad. I'm the policy director for the campaign. I'm going to do my best Jared Polis I can. Hi, everyone. My name is Jared Polis. I'm sorry I can't be with you in person today, but I'm glad to have this opportunity to share with you a bit about my plans for tackling mental health and addiction issues as governor. I believe healthcare is a human right, and one of the reasons I'm running for governor is to transform this fundamental value into reality for Colorado families. For me, like so many Coloradans, mental health care is personal. For years, my mother struggled with depression, and for long periods of time, she would withdraw from her friends and family and struggle to get through her day. Luckily, she was able to get the help and medicine she needed. I was proud to work hard in Congress to pass the Affordable Care Act and provide the largest expansion of mental health and addiction coverage in a generation. But we must do more. When I'm governor, Colorado will treat mental health and addiction as health care matters, not as criminal ones. I'll take on big pharma and crack down on deceptive marketing practices around opioids, and I'll work with the legislature to increase the number of health clinics in rural and urban Colorado that are able to offer folks living with addiction or mental health crises services. All human beings deserve dignity and opportunity, and that starts with ensuring their basic needs are met. Thank you.
Thank you so much. Okay. Stephen Barlock, go ahead.
Hi, everyone. My name's Steve Barlock, and I'd like to serve as your next governor of Colorado. Mental illness has affected my life as a young boy, as a teenager, as a college student, and my current life. I've seen family and friends commit suicide. And as governor, I look at one of the triggers that can cause that in mental illness, and it is a financial trigger. Every one of those people had a financial trigger in their life, whether it's the amount of debt that's growing for every college student in the state, or just not having the dignity of work. So as governor, I'm going to encourage everybody to have a dignified workplace. Thank you.
Thank you so much. Cynthia Kaufman.
My views and opinions on mental health have been shaped by both family experiences and by professional ones. My first job as an attorney was representing the Department of Juvenile Justice in Georgia, and they were sued in a class action suit over conditions of confinement in juvenile facilities. That's the first time I really started working with kids and seeing that if we had been able to do prevention on mental health issues, that many of these children would not have ended up incarcerated and in the pipeline to prison. And I vowed at that point, early in my career, that I would do everything I could to help prevent both juvenile issues and mental health issues. And I have had the opportunity to do that as Attorney General, working with law enforcement and training them on dealing with mental health, working on substance abuse related issues and treatment for folks. So thank you.
Thank you. Lou Gator, you are next.
There's two mics on this, so I'm going to try to use them both. Thank you, Sasha, for the question. That was an excellent question. On a personal level, back in 2009, I was diagnosed with multiple myeloma, a type of cancer, and told I wouldn't survive the summer. If that doesn't depress you, I don't know what will. That created my first personal mental health crisis. You know, that was several years ago, and I'm still here, so I guess I outlived that diagnosis. The challenge that we have is there are so many. I think we mentioned over 1 million people in the state of Colorado. That's 1 in 5 people, which means that of a room about 350, there's probably 80 of us in here that have some kind of mental health condition. At least 9 of us are sitting up front on the stage because we're crazy enough to run for governor. From a professional point of view, as a Larimer County Commissioner, we just recently instituted a program which is a co-responder program where we have mental health professionals riding along an emergency response with our police department, our fire department, and our ambulances so that we don't lock people up when there are better answers.
Thank you so much. Mike Johnston.
Thank you, everybody. My name is Mike Johnston. I'm delighted to be here. Before I spent the last 7 years as a state senator, and before that as a senior policy advisor to President Obama, I spent a good deal of my professional life working in different facets of mental health for young people. So I was the principal of a high school that contained a self-contained program for young people with mental health diagnoses and emotional disabilities. I then saw the treatment center world where I ran a treatment center facility for young people who couldn't succeed in traditional settings and were in treatment center placement. Then I ran a school in a juvenile detention facility where you saw what happened to young people who don't get the services they need and end up in correctional facilities where the treatment is not strong and the other factors are even harder. I will say I was in Grand Junction 2 weeks ago talking to some students who were sharing with me the fact that at Grand Junction High School last year they lost not 1 student to suicide in 1 year, they lost 4 students to suicide in 1 year. I think when folks ask, what is it going to cost to provide adequate mental health services to the state of Colorado? I think the deeper question is, what is it going to cost if we don't?
Greg Lopez.
You know, I come from humble beginnings. My mom and dad were migrant workers, and it wasn't until recently that I understood that I grew up with mental health all around me. You know, people suffering. I had a little brother that didn't speak, didn't hear, couldn't see. And my personal experience not only stems from very young in my lifehood, but you know, the lovely women of my life suffer from anxiety and depression. And so I have a very compassionate heart for individuals that are struggling every single day. You know, as a mayor, I was mayor of Parker, and I worked with the chief of police in making sure that when they engage with a young student, someone under the age of 18, that they were compassionate about approaching them, that they weren't not just flashing their badge, but remembering that they were human beings and that they needed to talk to them before they try to enforce any types of rules or regulations.
Donna Lynn?
Well, it's great to see everyone, and since the Attorney General came a little bit late, I think that means I get Jennifer Lawrence's role in the Hunger Games, I'm just saying. So I've spent 40 years of my career in healthcare, one way or another, 20 years in the public sector and 20 years in the private sector. And in the private sector, I've worked for 2 nonprofit healthcare organizations. I've been the CEO of both of them, including Kaiser Permanente here in Colorado and 4 other states. And integrating behavioral health and traditional medical care, to me, is the most important issue. As you heard, when you have a physical illness, it also results in mental illness. So I'm proud to say that we did pioneering work to build outcomes tools to actually have behavioral health, not isolated as a separate place that you go to, but integrated with primary care. And as the Lieutenant Governor now, I do that work through SIM, the State Innovation Model, which is now spread to over 2,000 physicians in Colorado and has amazing results that I'll talk about when I don't have a flag waving at me.
Victor Mitchell.
Well, good afternoon, everybody. My name is Victor Mitchell. I'm a Republican candidate for governor, and I come at this as an outsider, as an entrepreneur. I've actually built 6 different companies in different industries, from technology to telecom to finance. And my personal experience with mental health is extremely personal. We almost lost our daughter 5 years ago to mental health, and we never saw it coming. It started with an eating disorder. Then it came anxiety, then depression, and then potentially she thought about suicide. My wife has been amazing. She's been involved with NAMI for several years now. It was an incredible awakening for me personally and our family, and I've learned so much from that experience, and I think I can do so much for the good people of Colorado in resolving this issue. This is one of the few areas that I think that the state should be aggressively funding. I don't believe that mental health can be resolved with private insurance, basically because private insurance it's not predictable mental health. Every patient needs a unique patient plan. So I look forward to talking about that here today. Thank you guys so much for welcoming, and Andrew,
Thank you.
It's been a pleasure.
All right, Doug Robinson.
Thank you very much, Doug Robinson, Republican candidate for governor. It's great to be here with you. Just curious, how many of you have had mental health issues in your family or those that you know? Raise your hands. Oh my goodness, that's 95% of those that are here. My wife and I, Diane, we have 5 children, ages 16 to 27. When you raise 5 children, you have often some mental health challenges. Just this last week, we were in a behavioral health facility. Just 2 weeks ago, I had to do an intervention on my brother-in-law who blew out his knee and became addicted to opioids to try to get him to seek treatment. Last year, an employee of mine who we'd recruited top in his class from SMU got addicted to dabbing, high-potency THC, and took his life to suicide. I hope we talk about the relationship between drugs and what we're doing in Colorado and mental health and our challenges there. We can do better. Thank you.
Eric Underwood.
My name is Eric Underwood. I'm running for governor of Colorado, and I'm a Democrat. If you read the Denver Post this morning, you think I'm some rich, nauseous guy. Sasha, that's far from the truth. I grew up in a single-parent household. My mom had 6 children, 2 sets of twins, and I'm a twin myself. And we grew up in 3 housing projects. And life wasn't easy for us. And my mom had to struggle, and she was on Medicaid, food stamps, and a whole 9 yards. Now, things got better for me later. I went to college. I went off to work for United States Senator George Voinovich in Washington, D.C. as a Senate staffer. Then I went on to create a company, a digital technology company in Atlanta, Georgia, and I moved it here. And we're still going through a divorce right now with AT&T, but things will be all right. But I believe in mental health, and I'm here to talk about it, and I believe in your future, and that's why I'm running for governor.
Thank you. I neglected to say one thing to our incredible group of you that have come out today. If we could please hold our applause. Certainly it's generous for each candidate as they give their answers, but if we could just hold our applause until the very, very end, that'll keep us kind of moving along. Thank you so much. Our next question, and we're going to begin with Cynthia Kaufman on this one. Mental Health Colorado has developed a toolkit. That toolkit is to help schools and school districts get mental health services. So among the recommendations from Mental Health Colorado are to screen students for depression and other mental health conditions, to train teachers to spot the early warning signs, to engage parents and families, and to place more mental health professionals on site at schools. Would you support these strategies? And if so, how would you fund them? Cynthia Kaufman.
I certainly would support the toolkit. I think in conjunction with my answer I gave you before, I think we need to start very early and upstream in dealing with mental health issues, and placing mental health professionals in schools, something I strongly, strongly support. We have the Safe to Tell program in the Colorado Attorney General's office, and that's how kids can anonymously report concerns about themselves or their friends. We went from bullying being the #1 complaint to suicide and depression being the #1 complaint the last 2 years, or #1 tip we received. We've been able to intervene and save a lot of kids, but if we had mental health available in schools and access for the parents that would be easy and would be affordable, I think we could avoid getting kids to these crisis points. In terms of funding it, I think we have to examine what we're doing with money in DHS, because I think there's some savings to be had.
Lou Gator.
Yes, I would absolutely support it. The crisis we have in our schools is tremendous. As Cynthia said, kids taking their lives is probably one of the most tragic things we have in our society. And I was interested talking to a table earlier. We were talking about staffing for schools, that we need to get more staffing. We need better trained counselors. We need more counselors, just simply having people available to do it. In terms of how we get there from here, I think we have to raise the bar in terms of awareness with our legislature. We need to look at appropriations in the budget and decide what are we going to give up to make sure that we get this crisis in our society properly funded.
Mike Johnston.
Thank you so much. When I talked to these students from Grand Junction High School and I asked them about the crisis of suicide, they said, well, you know, at Grand Junction High School right now, there's only one counselor left for every 600 students. And so if you want to see someone, not just to get your credits sorted out for the semester, if you are in crisis, it's often a 3-week wait to get an appointment. And so when you talk about what is the school's responsibility to provide those services, I think this is why we're going to have to make critical investments into public schools to do that. That's why I both think the surplus dollars in the state budget this year that are ongoing ought to be dedicated to K-12, and I think long-term we're going to have to go to the ballot and repeal the most destructive parts of Tabor so we can actually fund public services like schools and roads and bridges.
Hold your applause, please, audience. Thank you. Greg Lopez.
You know, this is a truly complex problem, and specifically when we're dealing with our youth. And when you look at the educational system, so much has been lost as it pertains to building a relationship with the students, whether it's counselors or teachers. And I really do feel that these are types of programs that we need to really evaluate because they are impactful. But it's more than just government being involved. It's about a community understanding that they also need to recognize some of the symptoms, that it's okay for them to ask questions and bring somebody close to make sure that they feel that, one, they're not invisible, two, somebody cares. And again, when we educate our communities about the importance of this, which I think we are a long ways from doing that, I think we will make an impact. And you know, these types of programs, these toolkits, that's just the beginning. There's much more that we need to do.
Donna Lynn.
Well, one thing that I would say you need to do is make sure you have a Democratic governor next year, because Democrats have fought not only to pass the Affordable Care Act, but to push back on the attempts to repeal the Affordable Care Act, and we all know that is a good thing in Colorado. We only have 5% of the population uninsured, and 8 years ago we had 16%, and you know what happens when you don't have insurance. You ignore problems. You let them get bigger and bigger, and then the next thing you know, you are in an emergency room. You are in a suicide situation. So number one, Democrats will protect the Affordable Care Act. I've been doing that work with Governor Hickenlooper for the last 18 months, as unfortunately we've had to do that work. The second important thing that we do is that we get rid of the stigma associated with mental illness, because guess what? It is a lot of people. The third thing that we need to do is to focus on prevention, and what Mental Health Colorado has outlined is prevention is much better than taking care of people after they're too far down the road, and things like crisis hotlines and suicide prevention that we run in the state will do that.
Victor Mitchell.
Well, first and foremost, I absolutely would support the toolkit, but only as part of a holistic approach, because that's only the first step. We have to fully fund how we're going to treat people. And the way the system currently works, and I would have to disagree respectfully with Donna, I like to call it the Unaffordable Care Act. 40% of Coloradans today have health insurance. They can't meet their deductibles or copayments. It's as if they have no insurance at all. 26% of Coloradans today are on Medicaid. We have a 3% unemployment rate. And make no mistake about it, Medicaid is low-quality ration care. In fact, most doctors won't even accept the reimbursements. So there are many options out there, most especially around primary care, that can be done through effective nurse practitioner and physician assistant clinics for a fraction of the cost, as little as $60 per patient visit compared to $480 per patient visit on Medicaid. Thank you.
Doug Robinson.
Maybe like many of you, I sometimes get frustrated with talk and little action. And I'm a person of action. So last year, my wife and I, the organization we founded, went and convinced the legislature and the governor's office to put $10 million into the Department of Education to fund 150 mental health professionals in the schools. That is happening today across this state. There are 28 of them in DPS, and they have put in place this source of strength, peer-to-peer networking program. It is making a difference. Over 7,500 kids just in DPS have been implemented, have been affected in a very positive way just this year in the program that I helped to push and fund last year. We can do more. These kids, I was talking to kids at GW High School in Lincoln, and they're saying, I now have somebody to talk to when I'm stressed and have anxiety. It's making a difference in my life. We need action, not talk.
Eric Underwood.
Well, when we start pointing fingers at the issue with lack of funding for mental health care, we ought to have three fingers pointing back at ourselves. And Tabor is a big issue. And I'm the only candidate that wants to repeal Tabor. Now, we've had some Johnny-come-latelys on our side, on the Democratic side, but I was first and foremost saying that we have to repeal Tabor because Washington County doesn't even have a hospital on the Eastern Plains. They have to go to Morgan County to get health care and for emergency room visits. So we need to look at our priorities. America doesn't need to be great again. It needs to be smart again on how we prioritize the things that matter to us most.
Thank you very much. Our next question, and I'm going to direct. Oh, I'm sorry, Steve. Oh, Steve. Oh, I'm sorry, Steve Barlock. Steve Barlock. I'm sorry. Does he get an extra 2 seconds?
Well,
for
as
that?
I have a younger brother
Sorry.
who's in the educational profession, a teacher, an English teacher, they have a ton of responsibility on them. A ton. We really have to take this back to the home where possible, because we need to give parents the access and not just depend on the teachers in the schools. I am for the screening when possible, but we need to open up our education system to have individuals that can come teach that may not have had a teaching license before. We really need to open up opportunities, and the unions are not letting us do that. So we have to fight that and make sure quality professionals can come in our education system. Thank you.
Thank you, Steve. Now I'd like to direct your attention to the screens on either side of the room. This question is coming from Montrose High School student Sage Wilbur.
Hi, my name is Sage Wilbur and I live in Montrose, Colorado, where I attend Montrose High School as a freshman. I serve on the Colorado Youth Advisory Council as representing Senate District 6, my district. Effectively addressing youth mental health is an important issue to myself and my peers among the community. Thankfully, I have this proposition to ask you. How can you describe in detail the role our state government should play in addressing the epidemic of youth suicide in Colorado?
All right, so hopefully, did you all get to hear that okay? I know you couldn't see it, but Lou Gator, we're going to let you take this one first.
So thank you, Sage, for the question, and I'll tell you, with 1 minute, I cannot answer that question in detail. I doubt any of us could. I think, as you said, youth suicide is a crisis, not just in the Western Slope and Montrose, but across all of the state of Colorado. And I think as a governor and our state government, we need to recognize that we need to work with our counties, with our municipalities, with our school districts to make sure that they have the appropriate resources, whether that's dollars, whether that's counselors, whether that's co-responders, to make sure we can reach out to these kids in times of crisis. Those age ranges are hard to begin with, from late elementary school in through your early high school years. They're hard to begin with, and when you throw in all the crises and other things that we add to it and our challenges, is it any wonder why some of our kids question taking their lives? And I think what we have to do is recognize where they're at, and let's meet them and understand that life is worth living. These challenges that you have will not last forever, and you can get past it. So the state needs to take a leadership role in making sure we get this done.
Thank you. Mike Johnston.
Thank you so much. I'll try to do as much as I can in 60 seconds. I think the first step is you have to actually provide high-quality training for all adults that work in schools about earlier intervention and identification. Because what I know as a former teacher and a principal is you never know which adult a child's going to pick in the building to be able to confide in. So you can't say, oh, this is the one adult we've selected for you to come to when you're in crisis. What we know is there's going to be a teacher, it's going to be a paraprofessional, it's going to be a football coach, and so every adult has to have that kind of training and preparation. The second is we have to make the handoff really easy, so once someone has been identified, we now have services that are as close to the student as possible, preferably in that school building, so they can be quickly handed off to another trusted adult where they can get that support that is ongoing. And the third is, I really agree with what Donna said, which is how do we, as adults, especially adults that work with kids, model the fact that mental health is what we do preventatively to stay healthy. It is what we all do as a way to keep ourselves together, the same way that exercise is part of staying physically healthy. And I think the more we model that, the less afraid a child is to talk to an adult.
Greg Lopez.
You know, let me first say that just because I'm a Republican does not mean that I don't care for the poor. I think, you know, when you have a compassionate heart, and that's really what defines an individual and their character. It's not a letter behind their name. You know, when you talk about making sure that we are taking care of each other, specifically our children, you know, there's too much bullying going on, there's too much name calling, there's too much pointing the finger. When we as adults take the lead and monitor ourselves as self-policing and set an example on how we build relationships, you know, I think some of the struggles that we have in high school is that people feel invisible. They feel that they don't matter. And we need to make sure that they recognize that they're valuable to our society, they're valuable to everything that we stand for. And as we work with that and make sure that teachers, again, the teachers and the counselors are there to connect. It's not just another person, it's an individual.
Thank you. Donna Lynn.
Thank you. Well, I was privileged to work with the Colorado Children's Campaign, and yesterday released the 25th anniversary of Kids Count. I know a number of you were there. And there was a lot of great news, but the bad news was mostly on the mental health side. So we, in 2015 and 2016, are at the highest suicide rates for young people than we have been since the report was released in the early 90s. 1 in 3 high school students have reported experiencing sadness or hopelessness in it for at least 2 weeks out of the school year. Again, we've got to think about how we utilize, and I am concerned about teachers because teachers do a lot of things. We've got to complement them with professionals in the school that can take take the burden, take the responsibility for helping somebody find resources. We also have to work with peers. There's probably nobody more effective than your peer versus an adult. And so, in fact, getting young people to help out and call the question that
Thank
they
you,
do
Donna.
on Safe to Tell is important.
Victor Mitchell.
So how did we get here? I mean, how come this particular generation has we're in such an epidemic with school shootings, with considering suicide, with opioid addictions? How did we get here? I mean, what has happened in our society where somebody, for example, thinks it would be okay to shoot up a school? I remember going to school where somebody would actually carry a firearm in their glove box. It was unthinkable that they could ever shoot up a school. How did we get to a point where kids want to take their own life or even contemplate it? Yes, we have to do more in the public schools to get the kids the help they need, but much more broadly, we have to get to the root of the problem. Is it the digital age? Is it violence? Where is it the fact that our kids grew up during the financial crisis, saw their parents lose a great deal of money, and they have different stressors today than they did previously? But I think we're looking at this in just a too narrow of a scope. But it is such a serious and sad problem. Thank you.
Thank you. Doug Robinson.
In the kids count that came out yesterday, between 10 and 24 years old, the #1 cause of death in Colorado is now suicide. It has been car accidents for a long time. Isn't that amazing? We can and must do more. This program I was talking about just a minute ago, Sources of Strength, peer-to-peer, is seeking to basically have kids find a trusted adult in their lives. That is one of the key things. Kids say they have no adults that they can talk to. If they have one coach, teacher, school counselor, pastor they can go to, makes a difference in their lives. So we need to do more of that and rolling that out. We also have to have our eyes wide open. I fought the last 2 years tooth and nail to keep the Healthy Kids Colorado survey going in Colorado. The legislature wanted to shut it down because they didn't like some of the questions that were being asked. We have to be able to ask the questions to know what is going on in our school so that we can make a difference in the lives of our kids.
Eric Underwood.
I think the elephant in the room is cyberbullying, and how can we
Please hold your applause. Thank you.
How can we take this seriously when we have a president who routinely, on a daily basis, cyberbullies people? He sets the example. He's supposed to set the example for our country, and we're supposed to tell teenagers that it's not okay to, bully their peers. That's not right. And so we have to create examples first, to say this is not okay, and empower our school system to do a program. Maybe if you see something, say something, and have these kids talk to their counselor, say, hey, Johnny, has been off a couple of weeks, and not to get Johnny in trouble, but to have a school counselor engage Johnny so we can see what the problem is and so we can get Johnny the help that he needs. But leadership starts at the top, and so we have to look at that too.
Thank you. Stephen Barlock.
Well, I go back to that dignity at work, but I take it down to worth as students. I taught Denver Parks and Recreation for 13 years of my life. I did after-school programs and summer programs, t-ball, tennis, and watched children grow up. I saw changes in everything. The home is a tough place to grow up in, especially if you have two working parents, one working parent, one parent, or no parents. You have to help the parents, and teachers' jobs and people, coaches who go out in their lives have to be able to talk to them. But there's so much downput on that communication. No, you shouldn't be talking about my child. What are you going to know? Parents have to be accepting in this. When a person of responsibility for your child tells you something, please listen. That's the most important thing, is having family communication. Thank you.
Chad.
Cynthia Kaufman.
Sage asked what role state government should have in addressing youth suicide. And I think I would say to Sage, we owe it to all kids in Colorado to provide leadership, to provide resources, and to provide support. If we are not going to have a behavioral health transformation council in this state, then the governor needs to have a behavioral health cabinet something that Bill Ritter did. I absolutely believe that this needs to be elevated to an issue that the governor's office takes ownership of and deals with and provides that leadership. We should not expect teachers to be mental health professionals. Although so many teachers have that training and care so much about the kids, we should not expect teachers to be law enforcement. We should let teachers teach. We should provide others to support them in these roles in schools. And that's an extraordinarily important role of state government, to provide that leadership and to help the kids.
Thank you. Okay, the next set of questions. How are you doing down there, Derek? Can you shake it out a little bit? How's that flag arm working? Okay. So the next set of questions we have are going to be rapid fire questions. So these are questions that we would like a yes or no answer to only, please. I know.
Speed round.
Give it a shot. Why not? So the fourth question is going to be for Mike Johnston to start, and then we'll go ahead and go down the line from there. So here's the question. Current law requires insurance companies to maintain adequate networks of mental health providers as well as equal coverage for mental health and physical care. When it comes to accessing mental health care, however, many Coloradans report waiting longer and having to go out of network more often. Would you support efforts to strengthen the enforcement of mental health parity and network adequacy laws?
Yes.
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 I'm not sure.
Yes.
Yes.
I also have to look at the facts better.
Absolutely.
Absolutely.
That was great. All right. Question 5, Greg Lopez, we will start with you on this one. Last year, Eagle County voters passed a marijuana tax to fund mental health and substance use services. A number of other communities are now considering similar proposals. Would you endorse a state or local tax measure dedicated to mental health care?
If it went to the ballot and we asked the citizens,
Yes or no only, please.
Yes.
No.
No.
Yes.
No.
No.
Yes, we're putting one on the ballot in Larimer County.
Come on
Yes.
now. All right. Donna Lynn, the 6th question starts with you. Several states have passed laws allowing for guns to be temporarily removed from the homes of people who present a danger to themselves or others. These laws are called Extreme Risk Protection Orders or Gun Violence Restraining Orders. As long as due process protections are in place, would you support such a law in Colorado?
Yes.
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 1,000% yes.
Yes.
I would.
Yes.
Yes, I released this policy a week ago.
Thank you.
Yes.
No cheating, you guys. Come on. All right. Now, the rest of the questions will require more than a yes or no answer, but thank you for playing along with that. We appreciate that. Victor Mitchell, we're going to start with you for this next question. Colorado faces a high rate of substance use disorders and an increase in the number of opioid-related deaths. The legislature has considered a proposal to create clean injection sites and another proposal to add inpatient and residential treatment to the list of Medicaid benefits. Would you support either of those proposals or any other measure to address substance use?
I would certainly consider that. I wouldn't want to give an affirmative or a negative on that. But what's most important to note is most of our opioid addiction and crisis is in most of our rural communities around Colorado. I've actually visited 60 of our 64 counties. I've done over 500 events. There is an extraordinary urban and rural economic divide in our state. That's why I think 100% of our economic development incentives shouldn't go to companies like Amazon and should be going to small to medium-sized employers that can relocate and expand their businesses in rural and economically challenged communities. That would help tremendous amount where there are kids who are graduating have an opportunity. We also have to bring vocational trades into our public rural schools as well. This all links directly to opioid addiction. So we have to think about things in a more broader context.
Doug Robinson.
Thank you. So this is absolutely a crisis in Colorado. Many of the recommendations coming out of the Opioid Study Commission last summer that are making their way through the legislature, I am supportive of. And it is around doing exactly the things that they are suggesting, like educating the public around alternative pain management techniques. Also around giving more education to our doctors, limiting the amount of pills that can be subscribed. The one that I don't think is right for Colorado is to create basically put the government in the business of filling syringes or letting people come and shoot a drug that is very against the law. I don't think we should be doing that, but we have to be doing everything we can in terms of additional substance and abuse treatment prevention to help this opioid crisis.
Eric Underwood.
Yes to both measures. But let me just say this from a perspective of a person of color who grew up in three housing projects. This is nothing new, okay? The opioid addiction was called the heroin addiction in our communities, or back in the 70s and early 80s, it was called smack, okay? So let's just get it straight here. And I'm glad that there's now attention being made to this, treat this as a mental health disorder and disease more so than a crime. So I just want to point that out because I think that's very, very important that we talk about this. And, and let's just, now that we know where it's coming from and now that we're embracing the truth about this, now let's all roll our sleeves together and do something about it. But I actually agree with Vic in that it is a situation where we have to create jobs and opportunities for rural
Eric.
Coloradans.
Thank you. Stephen Barlock.
On the second part, where we have areas where they can inject themselves, the communities need to be responsible and have a say in where these locations are going to be because they are bringing an illegal drug into that community. Usually they shoot up as quickly as possible where they get that drug. So bringing that criminal element is, you're making the community probably not happy, putting a risk in the community because we are bringing that criminal element to a community. We have to fight this opiate addiction. I stand by the president full-heartedly in his battle against this, and the overprescription starts. So we have to hold our doctors more reliable on how they are taking care of their patients. Thank you.
Cynthia Kaufman.
As Attorney General, I have the privilege of chairing the statewide substance abuse trend and response task force, and we have been dealing with many of these issues. And I want to give a shout out to Lisa Rayville of the Harm Reduction Center in Denver. I do support clean injection sites if a local community wants to have one. It's a public health issue, and I want to prevent the spread of HIV and AIDS and hepatitis C. It's not ideal, but it is an option in a crisis. I think that I would definitely support inpatient and residential treatment services being paid for, reimbursed through Medicaid. I think that private insurers need their feet held to the fire on this issue because I think we do a better job sometimes with our government health care than we do with our private insurance coverage for substance abuse treatment centers, and I would support more medication-assisted treatment funding in the state of Colorado.
Lou Gator.
When I was on the statewide Emergency Medical and Trauma Services Advisory Council, that's a mouthful. We called it SIMTAC. I got a chance to ask a doctor about safe injection sites, and we were looking at that in Larimer County, and his response is, you don't already have them. And he was talking to me, and this was when I first became aware of the prescription opioid crisis that we had. And he said, that's our biggest challenge we have in the ERs right now is prescription opioids. And he said the safe injection sites, that's a no-brainer. You should be doing that right now. We've talked with our local Board of Health. I'm on the Larimer County Board of Health, and we have that in place. And I agree with Attorney General Kaufman that that is a decision that is best made by the local communities because they understand the impacts, and they're the ones that are responsible for implementing it. So I think you have to give the local communities the choice, and for those that want to do it, let's let them do it. And then we need to work on making sure those Medicare benefits are adequately and properly provided for.
Mike Johnston.
Thank you so much. I Yes, to Medicaid coverage for inpatient treatment, I think tremendously important. Yes, also to injection sites that local jurisdictions and governments have decided that they want to explore. I want to say an additional thing about this crisis, which is I think the most important thing we have to do is stop criminalizing drug addiction. Right? And so this is why, thank you, you're allowed to clap, but you will get in trouble for that, but you can take your chances anyway.
You'll get your cell phones taken away. That's what happens.
That's right. I think in addition to this, is what one piece of statistic here is that right now the average cost to incarcerate someone in the state of Colorado for a year is $40,000 a year. The average salary for a social worker in the city and county of Denver is $38,000 a year. So you could literally assign an individual caseworker to one person for an entire year for the same cost you could to incarcerate them, and I would bet you'll get a lot better outcomes with the second strategy. So we also have to make steps on making Medicaid-assisted treatment more available, remove prior authorization so that you can get folks treatment easier, and which I hope will come back to you, provide incentives for more and more mental and behavioral health providers to come to rural areas.
Greg Lopez.
You know, when we face these complex issues, we often try to find an easy solution. You know, let's look at the VA hospital. You know, we're supposed to provide services for our veterans, and the government can't even get that right. And these are people that put themselves in harm's way. So I don't trust that government can actually do things correctly. You know, when you talk about making sure that we are able to help people, let's focus on what's really is beneath the lining here. You know, people are struggling because they don't have hope. They don't have a future. They don't see an opportunity for them to be able to buy a house, to be able to make sure that they raise their family. You know, there's a lot that goes behind the psychic of a person that decides, I have no other choice but to try to self-medicate. And the physicians are also encouraging that. You know, so I would be very careful about jumping onto something very quickly because it seems to be the trend. We have to look into the future. We made a mistake with marijuana as it pertains to what is happening with our children in schools. Let's not do that again.
Eric Underwood.
I think you mean Donna Lynn.
I'm sorry, Donna Lynn.
I know we're the
Apologize, Donna. Yep, that's you, Donna.
Well,
sorry, Donna, go ahead.
I trust government. I've worked in government for 20 years, and there are 31,000 people that work for the state of Colorado that are doing the tough work for you every day. And some of them are taking care of people with mental illness, with substance abuse. And that's what a governor should do. He or she should trust government. That's number one. Number two, on the two issues at hand, absolutely, I would support them. I've been to the Harm Reduction Center as well. We fund the Harm Reduction Center. We fund many of these locations where people with mental illness and substance abuse problems can come and get counseling and referral for mental health treatment, can get HIV testing. We've got to continue to do that work. The last thing I really want to say on this is it is a crisis for us. And expanding Medicaid coverage is important. I've been doing that work for the last 2 years, as well as fighting the fight with our physicians, with our hospitals, to do the things that you saw in this interim commission that came out this summer. Thank you.
Thank you so much, Donna. So I'm going to give you a little setup for this next question, and Doug Robinson will have you go ahead and be the first to start on this question. But CBS 4's Alan Janae actually interviewed people to get some questions for the candidates. So here is the executive director of the Denver Recovery Group, and this will be a videotaped question from Denise Vincioni.
How are you going to address our housing crisis right now for the patients with opiate use disorder and other substance use disorder in the state?
And I'm going to go ahead and just repeat that because it was a little bit soft, the audio there. The question, how are you going to address our housing crisis right now for the patients with opiate use disorder and other substance use disorders in our state? Doug.
So we have a housing crisis in Denver. It's increasingly, not just Denver, but across the Front Range and rural parts of Colorado too, where it's increasingly unaffordable for people to be able to live here. So I think we need to talk about that as well, right, in terms of solutions. And there are lots of things that are, I believe in reform in terms of the permitting process, reform in terms of tort reform in order to allow the private sector to build more housing. We need to incent people to come in and build housing for people that are in substance abuse or in other areas. We had Arapahoe House, which is the largest provider of those that are really need these services, all of a sudden they couldn't come up with the money, $3 million, and we couldn't find that around the state in order to keep them going. So this is a crisis. So we absolutely have to do more to provide housing for these people, but to address the underlying problem of the cost of housing along the Front Range.
Eric Underwood.
Yes, I want everyone to enjoy this beautiful city and state, and increasingly people can't afford to live here. And what we have to start looking at is maybe rent control. And maybe it's time to start looking at that. And I would certainly look at that. New York City has it. We want to make sure that we do not price people out of their communities, through gentrification and other means as well. We also have to maybe look at mixed income housing, make sure that we create these programs where people, hardworking families, and people that can't afford it, but we give them a little bit of a lift where they can live just like the rest of us. I mean, the American dream should be for everybody, not just for people who do not have the deep pockets like some of us people do. So,
Stephen Barlock.
Our housing crisis is terrible, and helping people in need of all things, whether they be domestic violence, substance abuse, those housing projects are being basically torn down. The ability to have those are cities like Denver who let the developers go roughshod through these neighborhoods and communities, and including our state. We have a 5-year coming up where these apartment houses can be turned into condos pretty soon, and that's going to be a big movement. So pricing is not going to get cheaper. I would like to say that I'd like to have the government raise one tax, the legislature, and that's the tax on foreign-owned property, because I'm sick of Colorado being used as an investment portfolio. We need to have ability for people to actually live here. Thank you.
Cynthia Kaufman.
Well, there are so many folks who are struggling with the lack of affordable housing, and we've been dealing with it with domestic violence victims who don't have a place to go after they are in some sort of emergency shelter and need a place so they don't have to return to a situation where they are dealing with abuse. And it has been such a struggle to find housing, and so I'm very empathetic for all those who need the assistance. I have this fantasy driving down Colfax each day as I do to go to work, which is to take some of the vacant hotels and those that are used by folks who are there by the hour to use drugs and to sell drugs, and converting those to housing for people who, just as we're talking about, have substance abuse and opiate issues and need a place to stay short term for recovery. And I think there are many ways, there are many solutions, but we have to be innovative and we have to use the housing that we have more effectively.
Lou Gator.
In Larimer County right now, we're looking at building a mental health and behavioral health facility, and the idea is to catch those with lower income who are in treatment, who need a place to stay while they get their lives back together. It's not designed to be a long-term situation, but it is provided to give you a place to stay while you're going through treatment. Because those patients who are in substance abuse issues, they need treatment first and foremost, but they need a place to stay while they're getting that treatment. So we need to provide both. As you've heard, and I'm sure you'll continue to hear, we have a housing crisis in this state, and we need to continue to work on that, but we also need to work on our substance abuse treatment as well.
Mike Johnston.
Thank you. The downside of having one of the fastest growing economies in the country is you have people who can't afford to live in the neighborhoods where they grew up, or can't afford to live in the neighborhoods where they work. And I think that is a problem that we have to solve. And right now the problem is that the cost of land is so high that the minute a developer buys an acre of land, the cost of that land already has made anything that you build on that site unaffordable. And so if we're going to solve this problem, we don't have enough cash in the state budget to solve this with credits and with cash. What the state does have as an asset that I think we should use is land. So the state is still one of the largest landowners in the state, which means you can enter partnerships where the state says, we will partner with the developer on this plot of land instead of leasing it to an oil and gas company or building a strip mall on it. What we're going to do is actually build affordable housing on it with the agreement that if the state provides that land on a 30 or 50-year lease, any units built on that property would be at rent controlled at 30 or 40 or 60% of area median income, so you can have someone who can live there without worrying every 3 months that the new landlord's going to buy the property and jack the rents up 30%. So I think this is possible. We just have to think differently about how to use the assets the state has.
Greg Lopez.
You know, land use and zoning, when developers decide to develop, they buy agricultural land. It's when they get the zoning for residential that the value of the land goes up. But let's think about this, folks. You know, the population, today young couples aren't having the big families that the baby boomers used to have. Why in the world do we need to live in a house that's 1,800 square feet? I grew up in a 900 square feet home, and there was 5 of us. So we need to ask ourselves, do we really need all these big homes? Or can we identify areas where homes are built in a manner where people can afford, and it doesn't mean that everybody gets a bedroom, it doesn't mean that everybody gets a garage, it doesn't mean that everybody gets to live like a rock star. It's about providing shelter. And I think that's the conversation that you need to have with developers, is making sure they're providing a product that a lot of people can afford.
Donna Lynn.
Well, thank you. And I could talk a lot about housing, as everybody has here, but the question you asked was about housing and people with substance abuse problems or opioid addiction. And as many of you know, we have a housing crisis, but you can't simply give somebody a cheap apartment or a cheap house who has these problems and expect them to be able to function. So, as many of you do, we have to talk about supportive housing. We have to talk about making sure that the social determinants of health are integrated with a housing policy. And Sanderson Apartments is one example. There's multiple ones that churches have built where there is social work services available. There's transportation, because you could put that person in a house, but if they can't get to treatment, or you can't, obviously, given the economies of scale, have the treatment there, you've got to have the ability to make sure that everything that they need is provided, not simply an inexpensive apartment.
Victor Mitchell.
So I remember 10 years ago when I was in the legislature, and there was a trial lawyer bill that was proposed. It was called the Construction Defects Law, and it ultimately got passed in 2010. And I remember my Democratic friends saying it's going to have no impact on housing whatsoever. There's been no greater impact to affordable housing than the Construction Defect Law. In fact, we basically don't build condominiums, by and large, here in Colorado. And make no mistake about it, that's a disallocation in the housing market if you're a first-time home buyer, if you're downsizing. So first and foremost, I want to do away entirely with the Construction Defect Law. But I also want to make it easier for builders and homeowners to develop. So I also want to allow them to go to any certified architect and be able to pull their own building permit who has the appropriate accreditation. Right now, we're bottlenecked more often than not. Pulling a permit in the city of Denver can take upward to a year. We also have to deal with all the marijuana revenue taxes that's been totally ripped off, and it was supposed to help things like opioid addiction and other addictions and other affordable housing options, which should also be addressed as well. Thank you.
Thank you, and thank you to all the candidates. How about a round of applause for our gubernatorial candidates in Colorado? Thank you for being a part of the state of mental health. And I'm going to bring back up CEO and President of Mental Health Colorado, Andrew Romanoff.
Thank you. And a hand for Teresa Marchetta, our moderator, with a tough job. I want to join Teresa in thanking the candidates. I know we try to cover a lot of ground with 9 candidates in 60 minutes, and I certainly appreciate your commitment to this cause. We, as a nonprofit organization, can't endorse you, but we're glad that you endorse us, just to paraphrase Ronald Reagan there. And certainly glad that all of you are willing to share your time with all of us. I want to suggest in a moment a way for you to continue this conversation. But first, I want to just give one more unsung shout out here to Derek McElroy, who is our flag waver. Months of arduous training have paid off today, as you can see. In all seriousness, Derek also happens to head what we used to call the Young Professionals, now the Future Board of Mental Health Colorado. So if you're interested in getting involved, please see Derek. Maybe you can wave the flag once more time so that they can see where to find you. There's a few other ways for you all to get involved as well. On your table, you'll find a little brochure. On the back of that brochure are 3 things you can do. One is to share your story. We find one of the most powerful ways to demystify and destigmatize mental illness is to meet someone who's experienced a mental health or substance use disorder. We've created an online story bank for that purpose. You can find it at the website there. Tell us what it's like to live with a mental health disorder or to care for a loved one who has, because as you saw earlier, everybody in this room and every family in Colorado has a connection to this cause. The second thing you can do is get screened. We put up a series of screening tools on our website. They're free, it's confidential, it's easy. There's a screening tool around depression. There's one for anxiety disorders. There's one for parents to take if they're worried about their kids. We put up a screening tool for kids to take if they're worried about themselves. These aren't formal diagnostic instruments. They're just self-assessments. But the best part is when you take these quizzes, at the end, the computer will tell you where you might want to go for help. So that's important, because screening only does so much good. You need services too. And the last thing you can do to help make services more available is to join the WAVE. We've created a statewide network of advocates. We call it the Brainwave. We're trying to find folks in every single community across the state who will stand up and speak out on behalf of mental health care, who will act as the eyes and ears and voice of this movement. So if you've already joined the WAVE, how many folks have? How many folks are part of the Brainwave? That's terrific. So I hope all the hands will go up in the future, because we need people to pepper the next governor and the legislature and county commissioners and school board members and mayor and council folks, decision makers who will help them understand why mental health matters to so much of us, so many of us. We have a lot more work to do in the weeks and months ahead. Thanks for sharing your time with us today.